PCOS, what are my treatment options? Part 3, individual symptom approach. My name is Dr. Martha Bardsley, and this is part 3 in the approach to treatment of PCOS. As we've talked about in parts 1 and 2, treatment is aimed at what is important to you and for you. Here we're going to talk about other ways to address individual symptoms. In parts 1 and 2, we talked about first hormones, second insulin resistance, and this is hodgepodge. So hirsutism, which is the excess facial or body hair that some females with PCOS have, can be addressed in a number of different ways. One is shaving. You can extract the hairs, and this can be done with tweezers or epilation or waxing. Unwanted hairs can be dissolved or bleached. There are ways of preventing or slowing new hair growth. One is a topical treatment called eflornithine, which is prescription, and that will work as long as it's applied, but then stop working when it's no longer applied. And there's also electrolysis and laser or intense pulse light. The second thing that we'll talk about is hidradenitis, which is inflammation of the hair follicles in sweat gland areas like your underarm area or your groin. And ways of addressing this is to avoid irritation by wearing loose-fitting clothing in those areas, being careful with deodorant and shaving. You can do antiseptic application by applying something called chlorhexidine gluconate, which is also called Hibiclens and is used sometimes for people who are about to have surgery as an antiseptic. Benzoyl peroxide topically, zinc, light therapy such as laser or intense pulse light is sometimes used. Vitamins and minerals that can be helpful include zinc gluconate, 90 milligrams daily. And finally, there's a prescription topical clindamycin that can be applied or oral tetracycline. These are often prescribed by the dermatologist. Next, if you have PCOS and scalp hair loss that is believed to be due to elevated testosterones, then there is something called topical minoxidil 5% foam, which has been used to improve some hair regrowth in the area. It must be applied only to the affected area to avoid unwanted hair growth. So you wouldn't want it on your face or areas where you wouldn't want to have hair growth. It can cause itchiness, redness. It could possibly affect the hair coloring of the hairs that are there. Any of the treatments that will address hair loss take several months to start working, and oftentimes is combined with a medicine that we talked about in the first video called spironolactone. This has not been formally studied in adolescents less than 18 years, but there are many people who do use it and prescribe it, and there are case reports of some people with success using this. Anxiety and depression, of course, things to think about include therapy, sleep, very important. Some people do well with anti-anxiety or antidepressant medication, exercise, and meditation. Acne, topical treatments that are over-the-counter include benzoyl peroxide, salicylic acid. Then there are prescription creams that are listed here. And then if those don't work, then we can use prescription antibiotics or prescription Accutane if your growing is complete. This is, of course, treatment that was not talked about in the previous talks, but those treatments may be helpful as well. Sleep apnea is very important to diagnose and address. So this may include evaluation of your tonsils and other glands that you can't see very easily, which are between your nasal passages in your throat called the adenoids. If you think you have this or there's snoring, getting a sleep study and are using your watch or phone or video to evaluate your sleep quality and snoring, and then optimizing your sleeping conditions. So slide a side sleeping position tends to be better if you have sleep apnea. You want to have a temperature that's comfortable for you. Often that's cooler, and a routine, a sleep schedule. If you have allergies, seasonal allergies or other allergies, those should be addressed to keep your airway open. And if you have any sort of reflux, that should also be treated. What about fatigue? It's important to remember to think about iron levels. If you have evidence of iron deficiency, then replace your iron with either iron-containing foods or supplements. And if you are taking the medicine that was described in the second video called metformin, that can affect your vitamin B12 absorption in your gut. And so that should be checked. And if it's low, that can cause fatigue and should be replaced. Difficulty with fertility. So some people with PCOS may have difficulty getting pregnant when they want to. And the recommendations are basically to optimize your weight and metabolic health prior to that time. And then at the time or around the time at which you desire pregnancy, seeking specialist support early is important. And we have many different ways of addressing the difficulty with fertility.